In our Dr. Vention segment, strokes. If you have a stroke, your chances of surviving with little or no permanent damage could pretty much go either way. The number one thing you can do to help your chances is get some help fast. Call 911 so paramedics can start stabilizing you and get you ready for treatment at a stroke center like the one you're about to see in New Jersey. There, they're going to throw everything they've got at you to help you survive with as little disability as possible. By the time a person having a stroke arrives by ambulance to St. Peter's University Hospital in New Brunswick, New Jersey, the emergency room is poised to take over from the paramedics.
Code stroke is called, which means the CAT scan is cleared. The laboratory's notified. The minute they get the samples, they run it right away. The ideal is from door to treatment 1 hour.
St. Peter's is a designated primary stroke center, so Dr. Roger Behar, a neurologist, is part of the team. He's the last person John Christian wanted to meet. Dr. Behar found John's stroke on the right side of his brain. John had some of the typical symptoms.
I was very restless, and I couldn't get comfortable, and I had a mild headache. My wife noticed that the left side was drooping, and the same with my eye.
And his wife noticed something else.
She said, well, you're slurring your words.
She immediately called an ambulance. That decision alone makes all the difference. Time lost is brain lost.
Time is of the essence, because essentially what happens in a stroke is there's decreased blood flow to the brain. And the more damage that occurs there because of less blood flow, the lower the chance of recovering that brain tissue again.
Well, part of the brain just dies. That's gone. What you see is two types of MRI imaging. On the left, you see the part of the brain that's dead, and the white part of the brain is gone. The one on the right shows in the yellow the part of the brain that's at risk, called the penumbra. You can see it's bigger than the part that's gone.
The drug of choice to dissolve the clot and limit the damage, TPA.
The medication called TPA, which has to be given within a window of 4.5 hours. It is a clot-busting drug, which helps break up the blockage.
John was lucky.
It was in a very small vessel of the brain.
And he got the TPA in time. Then physical therapy.
Physical therapy for my left side. I seem to have a lot of problems with being able to lift my leg up.
John does have some lingering effects.
I sometimes lose my balance a little bit. Sometimes, my wife says, when your mouth gets dry, you sound weird.
And he's more than pleased with the care he got at St. Peter's.
I was born at St. Peter's, yes. So they brought me into the world, and they've kept me going for a long time.
Patients that come in through St. Peter's and they get the treatment in the right time frame, we see great improvement in their symptoms.
So let's go over the symptoms. Weakness, slurring of speech, and dizziness. If you have any or all of these symptoms, possibly building over half an hour or so, err on the side of caution. Get to a hospital immediately. And a little bit about how to prevent a stroke. It's a lifestyle thing. Eat healthy, lower your cholesterol, control high blood pressure, keep sugar to a minimum, exercise 150 minutes a week, and work at staying slim and trim. Also, be aware of your family history. It plays a big role.